Why does splenosis occur in the body? Imagine a tiny piece of your spleen breaking off and finding a new home somewhere else inside your body. That's what happens during splenosis. It usually occurs after an injury or surgery that damages the spleen. When the spleen ruptures, small fragments of its tissue can scatter within the abdominal cavity or other areas. These fragments are able to survive because they quickly establish a new blood supply from nearby tissues. This process is called heterotopic autotransplantation of splenic tissue. The main cause of splenosis is a traumatic event like a car accident or a blow to the abdomen that causes the spleen to tear. When this happens, tiny pieces of splenic tissue can disperse and stick to other organs or tissues. Sometimes, these fragments travel through the bloodstream and implant in distant sites like the liver, lungs, or even the brain. Most of the time, these ectopic splenic tissues are harmless and do not cause symptoms. They are often found by accident during scans for other health issues. From an immune system point of view, splenosis is interesting because these implanted tissues can still perform some of the spleen's functions. The spleen is vital for filtering blood, removing damaged red blood cells, and fighting certain infections. When splenic tissue survives outside the main organ, it can help maintain some immune responses, especially in people who have lost their spleen. This can reduce the risk of infections caused by bacteria that the spleen normally helps control. Splenosis is different from accessory spleens, which are normal extra spleens present from birth. Those develop during early fetal growth and have their own blood supply from the splenic artery. In contrast, splenosis is acquired after injury, and the new splenic tissue gets its blood supply from surrounding tissues, not the original artery. Doctors need to recognize splenosis because these tissue nodules can look like tumors or cancer spread on scans. Special imaging tests, such as a nuclear scan that detects splenic tissue, can help confirm the diagnosis. This way, unnecessary surgeries or biopsies can be avoided. In summary, splenosis happens when splenic tissue fragments break off after injury or surgery and settle in other parts of the body. These fragments can survive and grow by forming new blood supplies, allowing them to function somewhat like the original spleen. This process shows how resilient splenic tissue can be and how it can help support immune functions even outside its normal location.